So what happens if you treat cells from patients with choroideremia with a statin? And here you see on your left a cell culture of fibroblasts growing very nicely. And these are patients from these are cells from a patient with choroideremia. These are fibroblasts growing in cell culture. But if you treat the cells with a statin, they begin to round up. They're not quite as happy as they used to be. Well, we know that it's very hard to get eye cells of patients with eye diseases, but we have some wonderful molecular techniques that we can use now, that we can modulate normal tissue and make it look like, or make it almost the same as the cell having had a genetic defect. These are cells on the lower left of a retinal pigment epithelial culture from a human. These are fetal cells that were grown in culture, and they've been treated with a statin. And you'll notice that these cells are very cuboidal. They're pigmented, but they look quite healthy. So this is normal human fetal retinal pigment epithelium, and they've been treated with a statin, and they look pretty healthy. But once you treat them with a statin, and you knock down the choroideremia gene with an interfering gene called silencing RNA. So you're knocking down the choroideremia gene. So the choroideremia gene in these cells isn't producing as much Rab escort protein 1. So look what happens. The cell culture becomes less pigmented. Do you notice that? And the cells don't look quite right. They're not as happy. So the reason is that the Rep1 is not, remember, interacting with some of the proteins that are distributing the melanosomes in the retinal pigment epithelium.